Hi, this is Patrick Horn, president of GHAPP. Thank you to our sponsor, Johnson & Johnson, for their support of this podcast.
Hi, and welcome to GHAPPcast, the official podcast of the Gastroenterology and Hepatology Advanced Practice Providers, where we discuss all topics GI and liver, bringing you all the latest research, insights, and conversations that help shape best practices and inspire innovative care. I'm your host, Gabriella McCarty, a proud GHAPP member since its beginning, and today we're continuing our enlightening series on the role of interleukin-23 in gastroenterology with a special focus on interleukin-23 inhibition. So this episode aims to provide insight into a complex yet vital topic in gastroenterology and even rheumatology. We'll explore how insights into CD64 positive binding not only deepens our understanding of the immune system in GI diseases, but also can pave the way for potential treatments and improved patient outcomes. So I'm pleased to be joined today by Andrea Banty, a respected GHAPP faculty member and expert in the field. Andrea, would you mind giving us a brief introduction?
Yes, thank you. My name is Andrea Banty, and I'm a nurse practitioner. I've been working in the field of gastroenterology for the past 8 years, and the past 7 have been in a specialized IBG center at Cedars-Sinai in Los Angeles. And this is my first year joining GHAPP, and I'm really excited for the national conference.
Excellent. Yes, we are so excited about that. So together, we'll examine the importance of CD64 positive expression in relation to interleukin-23 and dive into how these interactions influence disease progression and discuss the exciting potential for therapies and patient care that this understanding reveals. And whether you're a seasoned practitioner, a new advanced practice provider, or just somebody that's fascinated by the dynamic field of gastroenterology, this episode is crafted with you in mind. Listen in as we unravel the complexities of CD64 positive binding and its implication for the future of gastroenterology. So let's get started. Andrea, I'm going to ask you some questions and we can talk back and forth. And I feel like every conference that I go to, I'm hearing about CD64 positive binding. Can you give us some background on what this is?
Of course. So CD64 is a receptor that's found on immune cells, and these immune cells play a large role in the production of interleukin-23. And interleukin-23, as a reminder, is a pro-inflammatory cytokine that is known to play a large role in the pathogenesis of inflammatory bowel disease and other inflammatory conditions.
Okay, great. So what I'm hearing is that CD64 is upregulated in certain cells during times of inflammation. So what's the relevance of that in the context of treating GI conditions?
So we currently have a few approved medications for the treatment of both Crohn's and ulcerative colitis that target interleukin-23. If there were a therapeutic option that can bind to CD64 receptors, this could reduce the production of interleukin-23 and could be an added therapeutic option for treatment of both Crohn's and ulcerative colitis.
Oh, great. Are there any examples of this that you can provide?
So there are medications that target interleukin-12 and 23 at the P40 subunit, as well as interleukin-23 at the P19 subunit. Examples of these, respectively, are ustekinumab, mirikizumab, and risankizumab. There is a medication that's approved for other inflammatory conditions like plaque psoriasis or psoriatic arthritis that also target interleukin-23 at the P19 subunit. as well as bind CD64. And the exciting thing is that it's anticipated to be approved for treatment of both ulcerative colitis and Crohn's disease. I'm not sure if I mentioned the name, but it's guselkumab.
That is exciting. I feel like we've had so many therapies. I've been in GI for the past 25 years now, and it is so different from when I started. I mean, with everything that has come out, and it's, different mechanism of action and different routes of administration. So it is such an exciting field and how far we've come for sure. So I'm starting to wrap my mind around all of this, thanks to you. What are the potential clinical applications of CD64 positive binding?
So like I mentioned, binding CD64 can play a role in reducing the production of that pro-inflammatory cytokine interleukin-23 and can potentially allow for healing in that inflammation on the mucosal lining for both ulcerative colitis and Crohn's disease.
That's great. So the information you provided has been great. I mean, I know I'm learning a ton. I feel like I learn something new every day in GI. Is there any way that you could kind of bring together what we discussed, a quick recap per se?
Yeah, so we have a number of really great options for treatment of both ulcerative colitis and Crohn's disease. But there may be a new therapeutic option that targets both CD64 binding to reduce the production of interleukin-23 and is an anti-interleukin-23 drug. So by targeting interleukin-23 or reducing its production, we can see a therapeutic benefit in reduced inflammation in both Crohn's and UC.
That's great. So my last question is, knowing so much about CD64 positive binding and in the context of IL-23 inhibition, how does this play into your therapeutic choice for patients?
So right now, we've been seeing really great benefits from the drugs that target interleukin-23, both at the P40 subunit as well as the P19 subunit. So when we have so many different therapeutic options, it can be hard to kind of choose one or tell the difference between all of them. So as the anticipated drug guselkumab is hopefully approved for treatment of ulcerative colitis and Crohn's disease, I'd be interested to kind of review the clinical trial information and review how effective, how safe it is for treatment of IBD, as it could theoretically work even better than something that is just targeting interleukin-23 with its ability to also reduce the production of interleukin-23.
Yeah, I agree with you. I mean, having more specific targeted therapy is much needed. I know we do have a lot of different therapies and it can get quite confusing. And I mean, I love treating IBD because it makes you really think. It is so not black and white, right? Everybody's completely individualized, and you really need to sit down with your patient, go through different therapies, different mechanisms of action, and they might have a preference on route of administration that they want. But it's, again, so great to have different ways to hit the inflammatory pathway and, provide great outcomes for these patients and get them into remission. So,
For sure.
Yeah. So any other closing remarks?
I guess I look forward to meeting everyone at the conference next week.
Yes.
Like you said, some really exciting things coming up and recent new approvals for ulcerative colitis and Crohn's disease. So excited to learn outside of IBD next week and be a member of the conference.
Yay. Yes, I'm excited to see you. So that concludes another engaging episode of GHAPPcast. the podcast for gastroenterology and hepatology advanced practice providers. So a huge thank you to Andrea Banty for joining us today and sharing her expertise on CD64 positive binding and its relevance in IBD and other inflammatory diseases, and the potential clinical implications as well that come with understanding this complex mechanism. So Andrea, I look forward to doing this again and seeing you in a few days. And to our listeners, we hope today's discussion has shed some light on the complex role of CD64 positive expression in relation to interleukin-23 and its inhibition, providing valuable insights to enhance your practice and improve our patients' care. So the exploration of GI conditions is ongoing, and each new discovery deepens our understanding and strengthens our ability to help those who we serve. So remember, GAPP is here to support you in your professional growth and providing resources, education, community of peers who share your passions and your dedication to your patients. So make sure to subscribe to GAPPcast on your favorite podcast platform. And don't forget to explore the growing GAPP world further. Visit our website at GHAPP.org. That's GHAPP.org. And connect with us on various social media channels like LinkedIn, X, formerly Twitter, Instagram, and Facebook for the latest updates, insightful content, and exciting announcements. So again, this is Gabriella McCarty. Thank you for tuning in for another episode.